My name is Dr. Christy Sullivan. I'm a pediatrician at the Iowa Clinic. I thought I would talk about sleep today because it is one of the things I get asked about the most from my patients from infancy all the way till they go off to college. Studies have shown that anywhere between 25 and 50% of all children over the ages of 6 months have trouble sleeping through the night. And one of the things that's unique about the pediatric population is that sleep deprivation can present very differently than it does in the adult population. For one thing, children in general need quite a bit more sleep than adults need. Also, when kids are lacking for sleep, they don't often seem tired necessarily, but it may present with attentional or behavioral problems either at home or at school or both. In the adolescent population, we also see it coexisting with a lot of anxiety and depression. So the first thing is trying to pick up on what may actually not seem like a sleep disorder, but is. As far as good sleep maintenance, there are some things that apply to all age groups. It's really important that kids are on a sleep routine where they're going to bed and waking up about the same time every day. That becomes really difficult in teenagers, but ideally they should be waking up about the same time even on the weekends and not sleeping in an extra 4 hours like they tend to like to do. In younger kids, that also really pertains to their routine at night, that they have a good quiet hour prior to going to bed where they're kind of doing the same sort of unwinding activities every night. It's also important that kids are active. We know that kids that are sedentary tend to have a harder time falling asleep than kids that have regular activity, but not a lot of intense activity in the couple hours prior to going to bed. Their room should be comfortable. Their room should be a place where they feel safe and don't associate it with timeouts or punishments. It's important that they're not hungry at bedtime. It's important that they haven't had caffeine prior to bedtime. And then one of the biggest issues we deal with lately in recent years is the screen time. And whether it's kids watching a TV show before bed or teenagers on social media, it's all electronics and screen time have been associated with later sleep onsets and sleep problems in general. Based on their age, talk to your physician about how much sleep they should be getting and ensure that they're getting to bed at a decent time at night and getting enough sleep, and that they're on a good routine. Establish that we're not going to do screen time the hour before bed, and we're going to focus on a quiet routine, which usually involves something like a bath and singing songs or reading books, brushing teeth, and just starting to unwind. For the adolescents, I think it's important that they self-regulate and in showing their parents that they're responsible, take it upon themselves to limit their own screen time, whether it's for an hour or two every night, or they turn their phones off and put them in a different room so that they can sleep. One of the things that's so unique to pediatrics, I think, is that we have patients that in many cases can't tell us what's wrong with them because of their age, and so we rely heavily on input from their caregivers and parents. So a huge part of my practice is education, and I spend a lot of time at every visit talking to parents about how to recognize that their child may be ill, how to know when you need to bring them to the doctor, how to know when they may not be developing correctly, or having problems in school. In older kids, how to recognize that they may be suffering from a mood disorder like anxiety or depression. The best part of my job is that if I do it well, then I get to have really long-lasting relationships with families. And I've now been practicing long enough that some of those first patients I had are bringing their kids to me now because they're parents, and so that's pretty awesome.